Okay, guys, welcome back. Quick update just because it's been about a month. I haven't made videos mainly because of college work that's been working on to me. So, had a lot of work that's piled on to me, and I haven't actually been making videos. That is my fault. I will correct that in the future. I will make sure I actually get stuff done in time. As I need to make sure I get my assignments in so I'm not backlogged like I was this weekend, where I have a lot of assignments weighing down on my head right now. And balancing it out so I can actually make videos for this channel and probably also be able to get videos made for the gaming channel, but not play games too much outside of content creation, just because I need to keep my priorities straight. So when my priorities are finished, then by the time I finish that, it's easy to get to do this for a long period of time. All right, so we'll get into the big things for this disease update. So the last time we left our video was about a month ago. When we left off, influenza nationally was about here, I believe. And we were going down fully. So, influenza now is low. We're approaching the low point, which it typically reaches at the end for the vast majority of the year. We're currently at 2.35 nationally on the CDC's flu scale, which is low. But we're about to be straddling the low to very low line here for almost the rest of the year until obviously the next flu season comes about. This flu season has killed a lot of people. It's been the worst in quite a long time. And it did peak late in February. So, although it's a bit late, it certainly did not underperform and did quite well for how much has happened. So we'll definitely keep an eye on this for next flu season. If we're gonna compare it to previous flu seasons, it has a much wider peak than the 2022 wave. The 2022 wave went up much faster and did reach a higher point, but it didn't stay as high for as long as the current wave has. After about a few weeks, it really started crashing down. But ours has a bigger under the curve here surface area, so a lot more people were able to be infected within this wave due to various factors of like genetic reshifting, like genetic drift of different flu viruses coming around at the same time. Unlikely for H5N1 to really play too much of a role here, although maybe some intermixing did happen, so we'll see how it affects next flu season, especially if we see anything happen with pigs more this year. But overall, had a terrible flu season with plenty of hospitalizations, even though most people don't really seem to notice that much because this isn't really something talked about by public health and communicated to the public as often. But had a terrible flu season. It is winding down. A lot of damage has already been done. Thankfully, we're getting towards the part of the year where flu is less transmissible due to environmental factors. But still, keep in mind, even as we enter late spring and summer, it's still something that can be circulating, especially if you're going to go to the southern hemisphere where it's going to be flu season there in just a little bit, a month or two. But the worst has passed us so far if you're living in the United States in most areas. If we were to look at a map for it, which we'll do right now, if you look at a map for most places around the country, the flu concentrations are low to very low. Some places are still hanging on high, like Louisiana, which is the only state hanging on high. It only has two sites reporting, but other states are still hanging on moderate levels. So depending on where you are, like Michigan, New York, Ohio, West Virginia, and Georgia, places like that, you'll still be more noticeable flu transmission. However, the main peak of flu is past, but even regardless, there'll still be people infected on the back end of the wave. So just keep that in mind. RSV2 as well, I believe, is very low nationally. It's still going down slowly. It's been slowly going down since about the beginning of January, which is a good thing. Compared to previous years, this is a smaller RSV wave, smaller than 2022, and definitely smaller than 2023, 24. And by 2022, I mean 22, 23, not 21, 22, because that's not visible in this graph. If we look at state trends, well, not state trends, but current, wastewater mapping. In some places like Missouri, which only has one site reporting, it's very high at whatever site it's being reported at. But in most places in the country, levels are very low. So the chance of you catching RSV from someone right now is much lower than what it would have been just a few weeks ago. But most places are straddling very low to low transmission, a few locations, except for a few locations like North Dakota, Nebraska. But there are a decent amount of moderate states still: Minnesota, Idaho, New York, and this is Nebraska. Yeah, there's still a decent amount of moderate transmission states, about five, but most states are still on the decline, which is good. And we'll pick back up on this if we see any changes, like maybe there's a significant change in the virus, which is unlikely, but we'll see. And then we'll check back on this when that happens, or by next fall, as we enter late fall and into winter. So we'll see how this reacts, and I'll give you the latest updates on this. As far as COVID 19 is concerned, it's low nationally. However, it's not really getting super low. As you can see, even though transmission is declining, the winter wave wasn't super high to begin with compared to, if we use all results, compared to where it could have been. Like in, for example, 2024, 23, early 24, second highest wave, 23, 2022 waves in early 2023. This wave is more on the cups of the summer wave of 2023. However, it's not as short as this one per se. It has a similar amplitude at the start, but it more hangs around this baseline for a lot longer, and we are seeing a decline, especially within the last 6 months. We are seeing a slow decline. So where nationally levels are low compared to being high for most of winter and then slowly dropping into low territory. But if we start looking nationally, there's still a decent amount of states with moderate transmission that are still hanging on, low to moderate transmission, while some states have higher transmission, like Kentucky, Virginia, and South Carolina. So transmission is slowly going down, but because the wave wasn't super amplified this year, mainly because there was no new variant that was biologically different enough or genetically different enough to escape the immune system. LP 8.1 is the dominant variant right now, and that's slowing the decline of COVID 19 transmission in the country. But it's not doing enough to actually start a new wave. We need to wait for a major change in the virus that has to come through, either, like I mentioned before, a recombination of two different viral strains, or a strain of the virus that develops within an immunocompromised patient, which I'll get to later, that has to get out of the person, and then we'll see a large wave afterward. But right now, in a lot of states, transmission is declining. However, in some states, it's more plateauing. So I'll show you one state. So Alabama is one example where the transmission is low per se. It's moderate, but it's still hanging around the general baseline of where it was back in December. So a lot of states right now are more so dealing with a high sea level, not necessarily dealing with a wave. Florida, in this case, hasn't had a large didn't have a large wave this winter compared to the summer they had a very significant summer wave, which a lot of places did, but they haven't really had a winter wave. They just have an elevated sea level here, and this isn't even really that elevated compared to what it could be. For example, if I look at another state, I'll take New Jersey as an example, state I am in. You can see here that the levels here are similar to what they were in the summer wave, even though we had a lower summer wave than the rest of the country. But as we're looking here, ever since about December, if the map will load properly, it doesn't want to load this specific portion. Yeah, ever since about December, we've basically been plateauing in this high region until very recently, where it's now starting to come down. But across the board nationally, it's mainly been high sea level, which is something that Dr. Ryan Gregory was talking about, where it's no longer about waves, large waves of COVID across the entire country. even globally. It's no longer more about that. It's more that you have high sea level, and then you have a wave imposed on top of that. So you're not seeing a large wave that overwhelms the healthcare system through the actual acute severity of the virus per se, because people have antibodies now because they are exposed so often. They have antibodies that protect them to a degree from severe infection, but that's not always guaranteed. But because the virus is very good at persistent infection and long term issues, long term chronic health problems, due to how it affects cells in the body, we're more in a situation now where chronic health issues from contracting COVID earlier and contracting it now are going to continue to get worse and get compounded from this high sea level of just the virus hanging around and not really declining in any real fashionable way. So if this is more of a trend where we see in 2025, except we may see a new variant eventually, we have to wait and see when that comes around. If we're seeing more high sea level, it's less gonna be the amount of deaths per se, that overwhelm everything. But it's more gonna be we're just gonna have a steady train of infections to just keep everything generally unsafe for a while. So you're just gonna continue hearing chronic coughing in the background. You're gonna continue to see rises in cancer rates. Example, like onset diabetes. You're gonna see increases in that. Changes in how people drive due to mental effects of it. You'll see changes there, but you're not going to see a large increase in deaths or the healthcare system being overwhelmed by the sheer amount of patients. But it will have that extra load is just going to be constantly there, just affecting the entire system. So JP Wellen actually posted about this. So currently, at least for where we are, we're at 260,000 infections a day, which is about one in 128 people currently infected. So if we did the math on that, that's a roughly around 0.7% of the population infected. Now that may seem like a low number, but rare in the medical context would mean percentages of 0.006% and lower. That's rare. So this is actually quite common. It wouldn't be too hard for you to walk around and find someone who actually has COVID-19. Not if you asked them, but if you had an ability to actually test them right at the spot and knew exactly what it would be, it wouldn't be too hard to find one of these people who just have it in public. But compared to where we are in past years at this time, where it's 152,000 in past years, or the levels, we were at similar to slightly higher levels in past years, but the rate of the slope decline here in past years was much higher because we were coming off larger waves. In this scenario, because the winter wave wasn't as large, we're coming down more slowly in this case. So this baseline will appear higher, but we have to see where it continues to drop. If it's going to continue to drop, it may continue to drop to around this 200,000 mark as all these waves post Omicron have been, after mask mandates have been lifted and people have not really been hearing about this too much. So levels should stay around the 200,000 infections countrywide per day mark for a little bit and then start to increase again. So this is the overall information, and then here are the states where the transmission hasn't really budged. So as far as spring is gone, so as we entered April, which just the information here for the CDC was up to April 5th. So the information for this week should come out next week. So Idaho, New York, Connecticut, New Jersey, Maryland, Virginia, North Carolina, and South Carolina, they're all having transmission that's roughly maintaining where it currently is, where it's not necessarily going down. So I guess you could think of this as the people who were infected last year have become susceptible again, so they're getting infected again this year, in a way. So although the wave is not strong enough, so you're getting a large amount of infections, it's enough to keep replacement, so it stays at the current levels around, in some of these states, around 1% of the population actively infected. So they will keep staying that way for a little bit. But if we've seen, like with the New Jersey graph, we're starting to decline now, we'll see how far that goes eventually, right? And then past that point, right? And past that point, we'll see what else happens. One more thing I like to mention, just in this thread that Mark Johnson put down here. I'll scroll down to the bottom. This thread mostly talks about HIV and the global fight against it. I will try and do a video discussing HIV specifically, but as we go down here, I have one, not necessarily one question, but one theory that we could propose here. So, because we know that HIV, which is human immunodeficiency virus, which is linked to a condition called AIDS, which is acquired immune deficiency syndrome, where your immune system is compromised, is not really able to fight off infections very easily. So we know that for COVID, at least, a lot of the major variants have come out of individuals who've had compromised immune systems. So therefore, they were not able to fight off the virus, which is SARS-CoV-2, effectively. So because of that, the virus is able to mutate within those individuals and become more advanced, as is able to test out different mutations and genes within a chronically ill person, so it was able to figure out what worked, and then eventually it regained its ability. It regained its ability for infection as it got out the person, and then rechanged itself so it could be better at infecting people, and then it became the dominant strain in the population until a new variant will replace it. So, for example, this right here, this graph isn't updated anymore because we're not tracking cases. But if you think about it, he's looking at this. These are confirmed cases, but they're not the same thing. So if we use this as a wave per wave basis, and this isn't necessarily per scale, but if we go back to like JP Wellen's graph over here, almost every single one of these peaks coincides with a major variant. So this early 2020 wave was the wild strain. This was the winter wave, and this was followed by the alpha variant, which is more easily seen by data that comes from the United Kingdom. So this little plateau here, you can think of as alpha. This spike here was delta. Then this is Omicron, and then everything after here. Although these are Omicron lineages, they're genetically not Omicron at all. Some of these were BA5. This was XBB, and these were the offshoots of XBB that caused this wave in 2023. Then we had the current JN1 strains that are still dominant now, and then JN1's offspring here that caused the major waves in the summer of this year. So the major hypothesis here is that because HIV weakens the immune system, and there are about 40 million people globally confirmed who have HIV, then it would be likely to think that a lot of these 40 million people who are catching the virus because of the lack of protections from governments, the lack of care for society that's been trained in, and the lack of information that's being circulated to people, even though there's plenty of information available, if we can think of it that way, whereas these people are getting infected by COVID from their surroundings, the people around them, and failed systems, that they're harboring the virus through persistent infections, and then from them, new variants emerge. Then we could kind of think of it as a way of, okay, so how do we protect, not just protect, but how do we prevent people who have immunocompromised conditions in general, prevent them from getting infected? So this is more, what if we did more to get masks more in healthcare, or just in society in general, clean indoor air? If we were able to do that, we could significantly reduce the amount of new variants that could come about, because there won't be as many people infected, especially people who have a compromised immune system, to produce these variants. That's the main theory I'm working with here. So if we think of this, there's about 40 million people who have HIV. So about 40 million people who need to take medication to keep the virus suppressed a bit, and to prevent its effects, and to delay, well, not really prevent its effects, but more tone down its effects. The more we have to think about that in the context of disease transmission is, we need to prevent them from getting infected in the first place, from both HIV and other infectious diseases, to limit the amount of variants that come from immunocompromised people because it's easier for viruses to mutate within them. And also, by preventing disease transmission to them, it also means any new variants that come from animals are going to be harder to spread in humans because once they do, the protections in place that we already have are going to be able to whittle down that viral strain that was able to jump into people. So then that will cut it off, and then it's going to take longer for another one to come around that can do the same thing. That's the idea that what we want to pursue, where just the amount of virus in general is reduced by our actions. So it's not something that we're going to have to pay as much, not necessarily not pay attention to, but it's not something we're going to have to devote as much resources to in the future if we do something now, right? That's the main. That's the main thing. That's the main substance of where I'm getting from the theory I'm trying to think of. So that was the disease update for, I believe it's April 13th. Yes. So that was the disease update for April 13th for people who live in the United States. I still want to get information from other countries and their wastewater surveillance data and be able to present it so I can make a better video. So if you guys, anyone who's listening to the video, if you have information, please send it to me. Do comments if possible, and I will try and take a look at it and see whether I can actually make it useful in this type of video. But I hope you guys, hope everyone enjoyed the video and learned something from it. As it has been a while, so I do apologize for not uploading. And yes, I do think that although right now levels of all viruses, not all viruses, we could probably check some, and some may be going up because I didn't fully check norovirus, for example, but I know that's also decreasing. But just always remember the main things you can do to prevent becoming ill from any infectious disease. Contrary to what other people are saying that there's nothing you can do to prevent it. No, there are things you can do, but it's more things that everyone should be doing because individual protections aren't bulletproof. They can't do everything. So the main things are get a respirator mask, make sure it fits your face, make sure you're always wearing it indoors, and also wear it outdoors. You never want to be in a situation where you needed to have it on but didn't. It's always better to be in a situation where you don't need to have it on but are, instead of needing to have it on but not having it at all. Another thing is also make sure you sanitize things. This is not super important for airborne diseases, but stuff that, especially at contact, is always good to maintain good cleanliness and hygiene just in general to reduce the amount of stuff that could spread. So keep that in mind as well. So buy wipes if you need to clean desks that you use. Make sure you're showering often, especially if you're going out in public. Just so anything that you pick up through your clothes, you wash your clothes and then you wash yourself. So it's easy to get stuff off of you. And then other things, especially if you're getting food from takeout or just food in general, make sure it's properly cooked, make sure it's properly washed as well. And if you do all those things, your risk should really go down. And then supplemental things would be once you actually do get ill, you need to make sure you have plentiful items to treat you, whether it be stuff that's actually specific to specific viruses or stuff to just maintain your overall health in general. So you want to make sure you're doing that. You want to make sure that you at least have a healthy diet. These don't prevent you from getting ill, but these help your body just in general stay healthy. So when you do get ill, you're not in a worse position. Make sure you're sleeping enough. Don't get too stressed. Try to make sure that you're managing your work effectively. All of these things, if you do them correctly, should be able to help you reduce your chance of being ill. And when you do become ill, it should make it easier for you to fight it off. Right? Just remember that when you are actually ill, if whenever possible, please stay home. The solution like wearing a mask is that you don't wear a mask just when you're sick. No, you wear a mask if you're sick, if you're forced to go out and interact with people, and even if you have to interact with people within your own home. Ideally, if you're sick, you should stay home, and you wear a mask every other time when you're in public, just so you don't pick up anything. All right, I hope this video was informative and all my tips helped in all the data I presented. So please tell me anything I need to fix to make videos better, and I'll see you guys another time. I'm not sure if it will be next week, but I need to make sure I make these videos more often, just so people have more information that they can actually access. All right, I will see everyone later. Thank you.